Hello, this is Dr. Tony Clark with learninganesthesia.com, and today we are now going to talk about some basics of induction agents. So I have here a list of induction agents. We're going to talk about their mechanism of action, typical dosing, side effects, and contraindications. So let's start with propofol. Propofol mechanism of action is it helps essentially activate GABA receptors. And that's specific for your GABA A receptors, if you were wondering. The dose, typical induction doses are 1 to 2.5 milligrams per kilogram. Again, an elderly sick patient, you may be closer to the 1 milligram per kilogram. A robust young patient may need more, like 2.5 milligrams per kilogram. These are just dose ranges. Side effects, of course, these are all going to provide sedation, but one of the importance is that there's no analgesic properties of propofol. Along with sedation, it'll decrease your respiratory rate, decrease your tidal volumes. It's a potent vasodilator, so it decreases your systemic vascular resistance. And it can cause pain on injection. One of the beneficial side effects is it decreases nausea and vomiting. Contraindications. The label says it's contraindicated in patients with egg allergy, but the literature doesn't suggest that. Another contraindication is long infusions can lead to propofol infusion syndrome. Etomidate is a hemodynamically stable induction agent. Its mechanism of action is also GABA agonism. Typical doses are 0.2 milligrams per kilogram. Side effects, one of the big things is it inhibits adrenal synthesis of cortisol, as well as aldosterone. Other effects, it actually increases nausea and vomiting. It's painful on injection. But it does not change your systemic vascular resistance much. In fact, sometimes your blood pressure may go up with it. And it is a sedative, so it will decrease your minute ventilation. And it has no analgesic properties. Contraindications is anybody that's adrenally suppressed. And then another important contraindication is anybody with acute intermittent porphyria. Going on to our next drug, midazolam can be used as an induction agent. For pre-medication, typically you're giving 1 to 2 milligrams. For induction doses, you're giving 0.2 to 0.4 milligrams per kilogram. It activates GABA receptors as well, just like the last two we've talked about. And of course, side effects are going to be the same. It will decrease your minute ventilation, but it's a lot less than propofol and etomidate will. It has no analgesic properties. And your SVR may or may not go down. Contraindications. I typically avoid it in patients that are over 70 years old because it can prolong sedation. Anybody with liver disease, I'd be a little concerned. And pregnancy. Moving on to ketamine. Ketamine It acts through inhibiting NMDA receptors. It's a PCP derivative. So one of the side effects, therefore, is hallucinations. Induction doses are 1 to 2 milligrams per kilogram. Side effects is that it's hemodynamically stable. It may increase your SVR. There's no change in your minute ventilation. It can increase intracranial pressure. It does have analgesic properties. Contraindications would be anybody with increased intracranial pressure. May or may not want to use it in anybody with a psych disorder. Unless it's depression, it can help treat depression. And anybody who's in cardiac extremis, because it's actually a myocardial depressant. Even though it increases your SVR. Going on to dexmedetomidine, otherwise known as Precedex. It is an alpha-2 agonist. Induction doses 0.5 to 1 mics per kilo. Side effects, similar to ketamine, it is not a respiratory depressant. It does provide analgesic properties similar to ketamine, but in a different mechanism. Bolus doses will decrease your heart rate and increase your SVR. Infusions will decrease your heart rate and decrease your SVR. Contraindications, anybody with severe bradycardia, anybody with you expect is going to be hypotensive. Methotrexate is a barbiturate that's frequently used in ECTs. It's a GABA agonist. Typically is 1 to 2 milligrams per kilogram. Side effects is it decreases your seizure threshold. Which is one of the reasons why it's used in ECT. It decreases your SVR, can decrease your cardiac output, and it is a respiratory depressant. Contraindications, if you're not using it to induce seizures, then would be seizures. Hepatic disease, it's cleared via the hepatic system. All right, let's now move on to this chart that I've provided with you. You can fill in. And just some things to remember about each sedative and interesting characteristics of each. So let's go down with propofol first. Propofol, one of the interesting things about propofol is it decreases your systemic vascular resistance quite a bit. But it inhibits the baroreceptor reflex, so you typically don't have a raise in heart rate with it. It may decrease your cardiac contractility slightly. It will definitely decrease your ventilation. Has no analgesic properties. Other things interesting with propofol, there is pain on injection. and it helps for PO and V. Etomidate. Typically your heart rate is unaffected but may go up. Your SVR is either unaffected, may go up. It does not interfere with myocardial contractility. Your ventilation will be suppressed. No analgesic properties. It is also painful on injection, but it actually increases nausea and vomiting. And the big thing here is suppresses adrenal function. Ketamine. Typically your heart rate will increase. It's known as to be a sympathomimetic. So your systemic vascular resistance will usually increase too. It's thought to be a myocardial depressant, especially in patients that are in cardiac extremis. Your ventilation is unimpaired. It has great analgesic properties. And one of the things you need to remember is that it's a PCP derivative, so patients can get hallucinations. And one of the ways to prevent that is by pre-treating with a benzodiazepine, like Versed. Next is dexmedetomidine. With dexmedetomidine, it's an alpha-2 agonist. Typically, your heart rate will decrease. And as we mentioned with the bolus, your systemic vascular resistance will actually increase. But with an infusion, your systemic vascular resistance will decrease. The reason being is giving the bolus of dexmedetomidine, it has alpha-1 properties as well. And so when you give the bolus, it initially will increase your SVR and decrease your heart rate. But with the prolonged infusion, the lower concentrations, it's predominantly alpha-2, so you get the decrease in your SVR. No change in myocardial contractility. Spontaneous ventilation is maintained. It has analgesic properties. And I guess the other thing to remember it's a unique mechanism of action of alpha-2 agonism, similar to clonidine. Midazolam, typically no change in your heart rate, plus or minus a decrease in your SVR. No change in myocardial contractility. Your ventilation is reduced, but not as much as propofol or etomidate. Has no analgesic properties, and maybe caution in liver disease. Methotrexate. Typically your heart rate can go down or go up. Your SVR is typically down. It is a myocardial depressant. It decreases cardiac output. It decreases your ventilatory drive. Has no analgesic properties. And one of the interesting things is it decreases your seizure threshold. So you're more likely to have a seizure. All right, that's it for induction agents. Hope you enjoy.